Hello and welcome once more to the Bench Report, where we discuss recent debates from the benches of the UK Parliament. A new topic every episode. You're listening to Amy and Ivan.
So today we're getting into something pretty complex. The huge challenge for families who are trying to navigate support for children with serious neurological conditions here in the UK.
And I think we should start on the human scale of this. What really kicks off these discussions is often a single family's story, like that of Shalina Begum. Her daughter Tafida became seriously ill, and the foundation she started, the Tafida Raqeeb Foundation, just shows the kind of labyrinth parents are forced into.
And that story really highlights the central point that came out of the debate, which is that support isn't, some kind of optional extra.
It's essential.
It's the difference between a family coping and that family reaching breaking point. And the discussion really zeroed in on three key areas where the system, it tends to fail.
Let's start with that first crisis point then, the moment of diagnosis. If you're a parent of a child with a rare condition, you can suddenly find yourself knowing more than the local clinician.
Which forces you to look elsewhere.
Exactly. Seeking second opinions, sometimes even looking abroad. That search for expertise is just a massive, massive stressor right at the start.
It is, and the proposals we saw were all about strengthening that early support. They aim to do it through three specific things. First, just getting consistent and prompt access to qualified second opinions.
In a second.
Second, bringing in mediation and clinical ethics support much, much earlier. The idea is to see it as a tool for collaboration, to actually avoid formal disputes before they even begin.
So it's proactive, trying to head off conflict.
Precisely. And the third point was about creating much greater clarity on safe hospital transfers. So if another qualified hospital here in the UK or abroad is willing to take on the child's care, the process should be clear. It's about making the family a genuine partner.
And that idea of partnership is so important because these parents basically become medical experts overnight. The sheer emotional and practical toll is just enormous.
It is.
So you see this need for consistent access to things like counseling, respite breaks, community nursing, but the provision is just so uneven across the country.
And if you connect that to the bigger picture, you see this systemic failure that many parents call, profound fragmentation.
Fragmentation. What does that look like in practice?
It's like the health, education, and social care agencies are all, living on different streets, and they never, ever talk to each other. They just don't align.
So they're not sharing information.
Not at all. A really painful example that came up was the shortage of educational psychologists. It causes huge delays for families trying to get an education, health and care plan, an EHCP.
Which means the parent has to be the one connecting everything, repeating their child's entire medical history.
Over and over again, to different people who won't communicate. It forces parents, and often grandparents, to become the case manager. We also heard about the postcode lottery for pediatric neurorehabilitation, which can make such a difference to outcomes.
So we've laid out this enormous challenge of fragmentation. What did the debate say about the government's plan to actually connect these services?
Well, the main strategy seems to be the 10-year health plan. The core idea is to shift care away from being just in hospitals and move it into integrated, community-based services.
How would that work?
Through what they're calling neighborhood health centers. So you'd have these multidisciplinary teams, specialists, social workers, all in one place, covering everything from epilepsy to rare genetic disorders.
And there were some specific targets mentioned, too, some standards they're aiming for.
There were. The Neurology Transformation Program, for example, is creating a national bundle of care for children with epilepsy. And crucially, there's a commitment to meet the NHS constitutional standard getting patients seen within 18 weeks.
And they have a deadline for that.
They do. March 2029, the plan is to expand diagnostic capacity to hit it.
This brings us to something families often call the cliff edge, doesn't it? The transition from pediatric care, which can be quite good, to adult services.
It's a huge point of failure. The debate really acknowledged that for conditions like cerebral palsy, for instance, the established health frameworks can just disappear when a child turns 18.
So what's the commitment there?
It's about structured transition planning, making sure it starts early and provides real continuity of care, not just a handover note. They also pointed to the financial support available, things like disability living allowance and carer's allowance, as a vital lifeline.
When you take a step back from all the policy detail, the discussion was really a tribute to the extraordinary resilience of these families.
Absolutely.
And the final thought really is that the system has to match that resilience. It needs clarity. It needs consistency. It's not about a radical restructuring, but just better coordination.
It's about making the system treat the family as a single unit that deserves clear, accessible support from day one.
As always, find us on social media at Bench Report UK. Take care.
Hello there, this is Tom, the producer of The Bench Report. Listener suggestions are vital to my mission of making politics more accessible and accountable. So, if you have an issue that's really important to you, personally or professionally, and want to know what those in power are doing about it, please get in touch via email or via our socials at Bench Report UK. I'll grab another coffee and start scanning those parliamentary archives.